And I think you alluded to that one of the big pluses is that there's much less collateral damage to the tissue because it is so focused, which obviously is better for the patient in terms of discomfort, things like that, but also the tissue itself if they want reconstruction down the line, et cetera.
It's very true. The collateral damage, some of the most important, is to the underlying lungs and heart. And I imagine you can tremendously spare, if not completely spare, those organs, right?
That's correct. It always depends on the location of the lumpectomy cavity within the breast itself. But in many women, we're finding that there's essentially no dose of radiation that goes to the heart or lung. And so we really think it will minimize any of those long-term side effects women experience.
But those side effects can be really intense. Can you talk about them a little bit?
Oh, yeah. So when you do what's called external beam and you hit the whole breast with radiation through multiple treatments up to 33, you get a lot of breast swelling and pain. You can get permanent breast swelling called breast lymphedema, where the lymphatic fluid is trapped in there. The skin itself can get kind of over-radiated and gets this kind of ruddy, brawny brown color that itches a lot of nerve pain. So if this reduces those side effects, this is a lifelong improvement, not just temporary during radiation, but it would really improve a woman's experience forever after the radiation.
Is the GammaPod available throughout the United States, or is it still limited to certain facilities like yours?
So it's currently limited to 2 facilities. So again, it was invented and developed at the University of Maryland Medical Center. So that's where the first unit is housed. And then I'm also excited to announce that UT Southwestern Medical Center in Dallas also just started treating patients with this technology last week, actually.
Great.
Good news.
And do you think we will be able to use the technology in other ways in the future?
We do think we're going to be able to use the GammaPod in very exciting ways in the future. So in the very near future, we'll have a clinical trial looking at using the radiation therapy prior to surgery. As we all know, oftentimes the tumor is very small. It may be 5 millimeters, but we do this very large lumpectomy that may or may not be actually needed. And so what we'd like to do is deliver the radiation therapy before surgery with hopes to actually eradicate the tumor before surgery. And then what we're hoping to identify actually is a group of women that we can totally get rid of the tumor with the radiation alone. And if we are able to find a group of women, then in the future that could actually really revolutionize breast cancer care for patients.
Wow. It was a real exciting improvement. Thank you so much, Dr. Nichols, and keep up the good work.
Thank you.
It's a star-studded episode of The Doctor.
3-time Emmy Award winner, best-selling author, comedian Louis Anderson, and celeb chef and best-selling author Rocco Spirito in the house.
Then,
The hottest new superfood on the market.
It's a bust.
plus,
What is this? What happened? And could it happen to me? This is a photo of a man's blood. Get to the ER yesterday.
The Doctors.